Kaiser here from the Mental Health Gym and the Rejuvenating Revolution. And you know what? It has now been almost exactly 2 years since COVID-19 started, or at least came to the United States. And you may recall that we had lots of concerns about what it would be like when COVID-19 came. We didn't know how long it would be. I remember seeing a video with Bill Gates saying in February of 2020 that they're prepared to stay home until May. And I thought, geez, May, that's a really long time. I went home one day, actually kind of got sent home from the hospital one day in February, just kind of assumed, it would pass like the flu and would, we'd all be back in time at some point. Here we are 2 years later, and although there have been some fits and starts, and we've been able to resume some sense of normality, we're still adapting to it. The Omicron variant is still pretty just ubiquitous. It's seems to be very contagious, even though in many cases, either because there've been so much vaccinations or because of the nature of the virus itself, that it doesn't seem to be as bad for most people. But it's still, not a great time. And many of us can identify all the things that have not been going great during this time. We've been limited in terms of events that we can go to, people that we can interact with, jobs that we can do, and so on. Yet, in the midst of this, we also find that there are improvements that can be made. And this is what I'm trying to address today. I'd like to be able to have us kind of share as a community what kinds of things can help us for however long this is going to continue to be the best versions of ourselves. Let me start. For one thing, when I wound up being at home most of the time, I found out that my kitchen is really very close to wherever I'm living and working in the apartment. And consequently, for a while, I worked with no restrictions in terms of taking snacks. Know what? After a few weeks, I'd gained about 4 pounds. And that was enough of an inducement to let me structure how I'm going to eat. Not just choosing the safest, healthiest foods, but also getting myself on a schedule so that I practice what I preach and only eat at structured times in structured places. It's helped me, for example, to kind of intermittent fast during the 12 to 13 hours between dinner and breakfast, which I do pretty religiously. Same thing, I should say religiously, I don't think there's been an exception. Same thing between breakfast and lunch, although I found that I work best with having a snack between lunch and dinner. So I've kind of instituted a healthy, structured eating plan, and the end result is that I now weigh 19 pounds less than I did at the height when I was 4 pounds over my what had been my normal weight. Now that's quite an accomplishment for somebody who wasn't, you know, in the obese category. Uh, BMI may have been a little high, but it wasn't in the obese category. So I think that's something that I've learned and I will continue. I've been able to structure in time during the day for reading as opposed to kind of, coming home from work, being tired, sometimes doing some reading, sometimes not, so on. Uh, I've also, since I haven't really gone to the gym much since it started, I've instituted an exercise program that includes daily walks of 45 minutes plus 3 or 4 times a week doing things with cables, weights, and or resistance bands. Again, these are things that I can do on a continuing basis and that I regard as self-improvement since the start of the pandemic. There are many other things that have taken place. In my case, being able to spend dedicated time with my wife on a consistent basis. Doing regular Zoom calls with friends. You know, we get busy and we forget about these things. And actually, some of my friendships have strengthened during these 2 years because I'm interacting with them more than I would, say, on a haphazard basis, where maybe once in a quarter or so, might go out to dinner with another couple, and then the next week, maybe a different couple. But overall, not maintaining the continuity of friendships. I'm not advocating for the notion that this was a good thing. It really wasn't. COVID-19 has caused a terrible toll in the country and in the world, caused many deaths, caused many people to have long-term effects, and even for people who have made complete recoveries, it impacted on their lives and on the certainty of their lives and their family members' lives for some time to come. Uh, again, it isn't a good thing, but sometimes great things can happen out of adversity. I'd be interested in hearing from you, and hopefully some of you will share your thoughts on what you did to make yourself better during the pandemic, and how can other people utilize those ideas in building their own strengths. So please feel free to leave a comment about it, and always know that I'm interested in hearing from you at ron.kaiser@thementalhealthgym.com. And if you're not a member of the Mental Health Gym, it's free. Make sure you sign up for it and get on our regular mailing list, and lots of other things coming your way. And until then, remember, none of us wanted to be in this situation, but we don't have to stay stuck in it. We can improve during the course of the pandemic for however long it lasts, and we can maintain some of the lessons and some of the behaviors and habits for the better for a long time to come. Take care. Looking forward to seeing you next time.